Hello, I'm Dr. Morgan Markman from City of Hope, and in our last session of Minutes with Markman, I emphasized, and I can't overemphasize the role of clinical judgment in optimizing outcomes in patient management. Nothing. There are a lot of important factors, but clinical judgment is so critical. However, if we now attempt to analyze the survival, and that's obviously a critical factor that everyone, well, what is the survival? What are the outcomes? But if we attempt to analyze the survival of a population of individuals, but I'm talking about the population now, managed in a particular manner, for example, employing that more aggressive, novel surgical technique, whatever it may be, or ovarian cancer patients who have undergone primary surgical cytoreduction of their advanced ovarian cancer, rather than a less aggressive neoadjuvant approach, even chemotherapy first, followed by surgery, it will be very difficult, if not in many settings, objectively impossible, to distinguish the actual impact of the specific modality employed, for example, aggressive surgery, versus the influence of clinical judgment, which led to the selection of patients best suited to have undergone that approach. For example, not having excessively extensive cancer beyond that what the surgery can do, not treating that patient with this aggressive approach when the surgeon will say it won't work. That patient wouldn't undergo the approach. Also, the question of the comorbidities. This patient has cardiac history is just too extensive. They had a stroke, even though it was only a mild one and completely resolved 3 or 4 years ago. I don't think I should do that. It's not wise to undergo this approach. So that patient would not get the more aggressive approach. Subjective determinations, clinical judgment, but nevertheless, that could impact on the ultimate survival of those individuals when you're trying to look at comparisons. So to be clear, there is absolutely no intent in anything I've said to minimize the role of clinical judgment in making essential, critically relevant management decisions. But this process will make population-based survival analyses difficult due to the inherent selection bias created by this determination of management. You might label this two sides of the same coin. And I thank you for your attention.